So today we have a patient with multiple skin cancers, and he happens to have a syndrome called Muir Torre Syndrome, M-U-I-R Muir, and Torre, T-O-R-R-E, Torre Syndrome. It's a genetic condition which predisposes you to have sebaceous gland problems and skin cancers, and also sometimes colorectal issues. So he has basal cell skin cancers as well, which you are predisposed to because of this syndrome. So we have, I think, I haven't counted, 8 different skin cancers we are removing today. And he also happens to have sebaceous carcinoma, which can be really annoying and difficult to treat because it can have what we call vegetoid spread, which can kind of skip metastasis. So we gotta really be aggressive with the sebaceous carcinoma. Basal cells, obviously they're concerning, but not as much as the sebaceous carcinoma, so we have to be very concerned about it. We'll be doing frozen sections, wide excisions, closing all the stuff, and we'll show you exactly what we're dealing with. So if you have anything to do with sebaceous carcinoma, multiple skin cancers, or along with colorectal issues, you have to get checked and get genetic testing done so you can get some genetic counseling and don't miss out on any condition. That's very critical. Okay, so we've done the markings, and you can see that for the dysplastic nevus F, I took 1 centimeter margins all around, and I designed a deformental flap, which is a variation of rhomboid. And the back over here, the neck, is a basal cell. You can barely see. I did elliptical area. Okay. And then we have D right here is a sebaceous carcinoma. So again, I took 1 centimeter margins all around to make sure that I'm good, and a deformental flap. Okay. It seems to work better for than the rhomboid in these cases. And they're very close, so I have to design them on different sides to make sure I have enough skin to close it.
I think he's a little drunk.
That's E is you don't need to talk. You're kind of just doing video recording for.
Well, I trust you implicitly.
Oh, you're very kind. Thank you. E is sebaceous adenoma, so I don't need margins. I'm just cleaning it up. The E, so E is fine. G is again a dysplastic nevus, so I got 1 centimeter margins, and I did a horizontal based deformental flap. So you can see the complexity, just for the students and the interns and residents, that we have so many different things. We have the A and B. We're gonna take care of it right there with the post auricular flap. Okay. Then we gotta move. After we are done, we're gonna move the neck, and we'll do the C over here, basal cell, pain in the neck. Okay. Then we gotta do these, and send them all for frozens. And you can do Mohs as well, absolutely, for these cancers, but the patient insisted for a frozen and complete closure by me, so I'm respecting his wishes. Okay. So we have completed the procedure. The first one was the basal cell that came back negative margins on frozen, and we did a post-auricular flap for it. You can see right here, from behind the ear, and flipped it over right there. Second was the cervical basal cell right there. We did elliptical excision, and that's done. And then we have right here, this was dysplastic nevus. So we did a deformental flap. Then there was sebaceous carcinoma, deformental flap, and that came back negative on frozen. That was a sebaceous adenoma right there. That was primary closure, elliptical. And then we have again the dysplastic nevus here, and closure was deformental flap, and they're all done. And we are all set. Perfect.